This is Mortgage Lending Mastery. Get the knowledge you need from America's mortgage mentor with more than 35 years of experience and over $1 billion in lifetime fundings. You'll learn to advance your mortgage practice quickly and efficiently. Also, be sure to check out Jen's book, Launch: How to Take Your Business to New Heights, available on Amazon. For a signed copy, contact Jen at jenduplessis.com. Now, here is certified mortgage planner and CEO of Kinetic Spark Consulting, Jen Duplessis.
Hey everyone, Dr. Elizabeth Hughes here. So I want to spend a little time talking about really the statistics and the science of how stress affects your health. And I know this is kind of a bummer subject, not something you normally see as you scroll through Facebook. And this is going to be a little bit of a longer video, but bear with me because there's some really, really important stuff that I think everyone should be aware of that I'm going to talk about. So I want to talk today about death and the causes of death. Now, the top 10 causes of death, at least in the United States, have been pretty constant over the last decade or so. And I want to go through those causes right now, not to bum you out, but I want to talk about how stress is related to these common causes of death. And you'll be surprised at what you learn because everything, some of these things that I'm going to list here, you're going to say, how is that related to stress? But I've got some science and some information for you. So I don't normally have notes, but I've got a card, so I'm going to make sure that I read off the top information and the top causes of death. So in order, the number one cause of death is heart disease. The number one cause of death is heart disease. I don't know where I did that. Heart disease is number one, followed by cancer, unintentional injuries, chronic lung disease, stroke, Alzheimer's disease, diabetes, pneumonia, kidney failure, and suicide. All right. That's not a fun list to listen to, and I thank you for watching this far. So let me talk to you about how stress affects and is related to this very morbid sounding list. I want to do this in a couple little groups. So I want to talk about heart disease, which is number one, stroke, which is number 5, and kidney failure, which is number 9 together. Because as biologically, as a scientist, those are all related to circulation. Kidney usually fails because of high blood pressure. The most common cause of stroke is high blood pressure, or it's a major cause of stroke is high blood pressure. There's some other causes as well. And heart disease, high blood pressure plays an enormous role in high blood pressure. High blood pressure plays an enormous role in heart failure and heart valve dysfunction. So high blood pressure is directly caused by the stress hormones. If I give you a shot of adrenaline or epinephrine, same thing, your blood pressure is going to go up. That's what it does. Adrenaline also causes the heart to beat faster, which is more of a strain on the heart. And like any muscle, the heart eventually gets tired. So you end up with adrenaline at putting a strain on your heart and your blood vessels, and by extension, the blood vessels to your brain, which is why you can have strokes, and the blood vessels in your kidneys, the teeny tiny little blood vessels in your kidneys that filter your blood. Stress with the increase in epinephrine and other stress hormones causes all of these problems. It is directly related to how the heart and blood vessels and kidneys work. So there's 3 out of the top 10 where stress has a direct and immediate role. So let's talk about the next one that I want to talk about, which is number 6, diabetes. I talked the other day about how the stress hormones, and in this case for diabetes, it's really the cortisol hormones, immediately affects how you metabolize food. It has an immediate and active effect. Well, diabetes is a condition where your body is not metabolizing and not handling sugar properly. This is type 2 diabetes, not type 1, but type 2 diabetes, which is the more common type, has a direct link to cortisol. And if I, as a doctor, prescribe long-term cortisol treatment for a person, diabetes is a side effect. People become diabetic from long-term cortisol administration. And if your body can produce it too, and you have long-term high cortisol levels, you are going to end up with diabetes. It's just one leads to the other pretty much every time. So that's 4 out of the top 10 with a direct cause or direct link to stress. Let's talk about chronic lung disease. And really what the list is talking about is lung disease caused by smoking. Now, many people who smoke because they feel stressed, and the only way they can relax is to smoke. And I totally and completely get that. But if we were to get rid of all smoking, that chronic lung disease would probably drop way down on the list. And of course, if smoking is a major cause of, or if stress is a major cause of smoking, then we have chronic lung disease, which is number 4 on the list, having a stress-related source way underneath. You're stressed, so you smoke, and you get lung disease. There's 5 out of the list of 10 which are directly related to stress. All right, so let's talk about, I want to talk about cancer and pneumonia together. And pneumonia, we're going to talk really about pneumonia and infections in general. So one of the major things that long-term exposure to cortisol does is it totally messes up the immune system. The immune system starts to act all haywire, and it stops doing its basic functions of eliminating bacteria, doesn't fight bacteria, doesn't fight viruses or funguses very well. And again, if I give people long-term cortisol, they are at increased risk for infection, including pneumonia. And at the same time, our immune system is supposed to detect precancerous cells and eliminate them before they turn into actual cancers. Long-term exposure to cortisol changes that function. The body no longer detects and destroys abnormal cells because the immune system is kind of paralyzed by long-term cortisol exposure. So that on this list of 10 causes of death, you don't think of pneumonia, lung infection, and cancer together, but they're both a result of an abnormal immune function. And abnormal immune function can be caused by stress and is caused by long-term cortisol exposure. So now we've got 7 out of the 10 major causes of death related to stress. I want to cover the last 3, and this is where things get a little surprising. Well, maybe not. So the 10th on the list is suicide. And obviously, people who are stressed may also have other mood disorders which can lead to suicide. So that's not really a big stretch to see how stress, chronic exposure to stress, can cause anxiety, can cause depression, and can unfortunately lead to suicide. And this is something that, at least among doctors, we see in our own colleagues. A lot of stressed out doctors, and doctors have a very high rate of suicide compared to other professions out there. And I totally believe that the stress of being a physician, especially now, is leading to that. But then let's talk about unintentional injuries and Alzheimer's disease. What do these things have to do with stress, you probably say? So Alzheimer's disease is number 6 on the list. Now, there's no good studies right now that really clearly show that Alzheimer's disease is caused in humans by stress. But there's some great mouse studies, fantastic studies on mice and rats. Now, in order to stress out a mouse, you can't give it a demanding boss, and you can't give it an impossible deadline or stick it in traffic. It won't care. So there are ways to stress out mice and rats, which are to isolate it. They are highly, highly social animals, and so an isolated mouse is a stressed out mouse. The mouse can be put in a situation where they get random, inescapable shocks. And we can talk about that down the road, but that's a huge cause of stress, is you don't know when you're going to get the next shock, and there's nothing you can do about it. You're completely powerless to avoid the shock. And then the third thing that can cause stress in rats and mice is being confined in a way that they cannot move, so restrained in some manner. So whether it's in a very, very tiny cage that doesn't allow them to move around, or it's actually to be pinned down, that causes major stress in rats. So for the Alzheimer's studies, the rats are restrained. And in those rats that have been restrained, subject to that stress, the precursors of Alzheimer's in the brain, including the amyloid plaques, an increased level of the proteins that make up the amyloid plaques, have been demonstrated in multiple studies. And the neurofibrillary tangles, the sort of messed up nerve endings that are seen in brains, are also seen in rats that are exposed to stress, that are intentionally stressed. Now, you can't tell whether or not a rat has Alzheimer's. You can only look at the brain and see if it has the same changes of Alzheimer's. But the answer is yes. Rats produce the same Alzheimer's proteins, and their brains look like Alzheimer's patients. So I know there's a big push for a cure to Alzheimer's out there. I think we've got to cut down on stress. The years and years of chronic stress are predisposing the body to make these changes in the brain that can lead to dementia. And I know personally, because of my grandmother died of Alzheimer's, and it was a miserable decade, basically, living with her. And I really wish that she could have been spared those years. She was not happy. So stopping stress would be ideal. If you're worried about Alzheimer's disease, cutting down on stress is major. Now let's talk about the third one on the list, and the final one that I'm going to talk about, which is unintentional injuries. All right, now here you're probably thinking, injuries are accidents. Like they don't, nothing has to do with stress. How can that have to do with stress? How can I, predict when I'm going to have an accident? I'm just going to give you 3 studies. Well, first off, I'm going to say, first thing, stress does lead to substance abuse, intoxication, and things like that can cut down on your acuity, make it difficult to drive, and make you more prone to having accidents. But leaving that aside, I want to give you 3 bits of 3 studies that I've found. So, occupational psychologists went into different work environments and had the people who worked there rate their stress levels and how stressful work was. And what was interesting, in moderate to high stress work environments had a 40% higher rate of accidents. Isn't that interesting? People felt stressed and there was more accidents. There's been studies that have looked at what's happening in a person's life before major car accidents. And there is a clear correlation between car accidents and stressful life changes, like being fired, having financial difficulties, illness in a loved one. Things that cause stress can lead to car accidents. And you don't, I'll talk about why this might be later in just a moment. And then a study of military So the military is obviously it's a dangerous, difficult job. And unfortunately, people do pass away with military service, but there's also accidental deaths in the military when you're dealing with, dangerous materials and the like. So the military did an analysis of accidental deaths and found that people who had career challenges, whether they were stagnant, passed over for promotion, they had not had the normal progression or their progression through ranks had been delayed, or people who had been recently demoted, had higher levels of accidental deaths, not related to combat, but just accidental deaths, and not ruled suicide, complete accidents. So I believe that stress affects our ability to think on our feet quickly, to avoid a car accident, to avoid that workplace accident, to be aware of our surroundings. And that is probably how it leads to these accidents. Near misses happen all the time. Anybody who goes on the highway knows that there's always, something that could happen. But if you are stressed, you are less likely to be able to avoid that. Same thing in your office space or any place that you work. You're not going to be as quick on your feet to move and change and avoid accidents. All right, that is the end of this. I know this is kind of long and really kind of bummer talk, but I think it's really important that we talk about the fact that stress really does make a difference in our health. And stress is directly related to the top 10 causes of death. And I forgot to say this earlier. These top 10 causes of death are responsible for 74% of deaths. So if you can say 74% of deaths have, in the United States at least, can't speak for other countries, but if 74% have direct ties to stress, why is medicine ignoring it? Why? It's just something to think about. All right, that is all for now. Thank you so much for watching. I really appreciate it. I also love comments. Say something below if you want, and I'm happy to answer questions. So for now, I'll say bye and thanks.
Thank you for listening to Mortgage Lending Mastery. Looking to streamline and launch your practice by accessing Jen's tools, courses, classes, presentations, and resources? Visit jenduplessis.com to learn about the features and benefits thousands of other professionals have experienced by enrolling in Jen's lifetime membership program. Isn't it about time you consider a coach to take your business to new heights? Contact Jen to start your application process today. Thanks again, and be sure to tune in next week.